Growing up in a home where I did not have support in certain areas of my life, I always told myself that if I were put in the position where I could offer that for somebody else, I was going to. I think that's why I struggled in a hospital setting, because you see them until they're better and then they leave. And mental health is a little bit different because you do backpedal a little bit. That is a normal part of the process. That's how we grow. So getting to be here and watch them succeed and watch them fail and getting to push them and have a relationship with them past what their vitals are, it's amazing to me, and it makes me want to come to work, and it makes me want to be better as a person. These kids definitely teach you how you yourself can be better, and it pushes you as an individual, not just them.
I think actually what makes our program different is the fact that we are so integrated as staff. Our staff are in the milieu, they're part of the day-to-day interactions, they're doing the chores with the kids, cooking meals, feeding the horses, grooming the horses, and I think that sets us apart. But it also helps the kids understand that there's different ways to support them, and being there with them, doing things with them is a really good way to support them and show them that you actually care.
For me personally, I treat them just like I would want my kids to be treated. If my kid was away from home, I would want them to have their Christmas presents wrapped on Christmas. So for our staff to do the little things like that, to go out of their way to make sure that those kids get their birthday presents, get birthday cake, I feel like our staff really does a good job in making this feel like a home away from home, and getting phone calls and letters and stuff from home. I feel like we do a pretty good job at that.
And truly, I see so much compassion here. It's the small things in that, and it's the big things. We're here on Christmas, we're here on Thanksgiving, we're here on Sunday mornings when we do want to be with our families, but this is also, a second home for us. And we care so much about these kids. I think no one would work here if they didn't care. No one would commit to this if they didn't have that in their heart.
My role as a nursing assistant, medically obviously, is my first priority, but it is a blast to be able to go on a ski trip with them, to go horseback riding with them, to be able to watch them laugh and grow as a person versus just seeing them in a hospital bed. Watching them interact with their peers and grow with their therapists, and even watching their family dynamics and watch that improve. It's amazing.